In this video, you will learn about dialectical behavioral therapy, which is one of the best treatments for depression, anxiety, and PTSD. The resource we offer has helped hundreds of thousands of people treat depression, anxiety, and PTSD at home without the expense of a therapist. It has sold over 500,000 copies and still gets 4.7 stars on Amazon, where it is a #1 bestseller. In this video, you will learn what dialectical behavioral therapy is, how it works for depression, anxiety, and PTSD, and about that at-home resource we just talked about. Dialectical behavioral therapy, otherwise known as DBT, is another offshoot of cognitive behavioral therapy. It is different from CBT in that it specifically teaches emotional regulation, distress tolerance, anger management, and how to thrive in your interpersonal relationships. It is endorsed by the American Psychiatric Association, the National Alliance of Mental Illness, and the National Institute of Health. It is one of the most effective treatments for those who struggle with self-harm behaviors. Sexual trauma survivors also respond extremely well to it. DBT focuses on helping people change their behavioral patterns. Helps people who have overwhelming feelings of pain, rejection, intense emotional reactions, or impulsive behaviors. It can greatly improve your ability to handle distress without losing control and acting destructively. DBT relies on mindfulness skills. It teaches specific techniques so you can learn to live with pain and accept how things are instead of suffering and trying to change them. Works for depression by reducing harmful behaviors, improving emotional stability, breaking the cycle of negative thinking, and strengthening support systems by creating positive social connections. It works for anxiety by teaching you to see anxiety-producing situations more rationally. It provides tools to get through intense anxiety situations without making things worse. You learn how to effectively regulate your emotional triggers so they don't control your life. For PTSD, it teaches how to be present and grounded in the moment and how to manage your emotional responses to those trigger events. It helps the user understand, manage, and change overwhelming emotions so they don't lead to suicidal ideation. It provides skills to get through crisis, intense emotional pain, and teaches interpersonal effectiveness. DBT helps with your personal relationships. It teaches you to communicate more effectively and to better navigate conflict within those relationships. The at-home resource we highlight in this video is especially good. It is called the Dialectical Behavioral Therapy Skills Workbook. It is the absolute best book for learning DBT skills at home. There are other DBT self-help books out there that are specific for depression or anxiety or PTSD, but none of them have the amazing track record that this one does. This workbook offers evidence-based, goal-oriented, step-by-step exercises for learning DBT concepts and putting them to work in your own life to create a lasting change. It has specific exercises for learning mindfulness, interpersonal effectiveness, emotional regulation, and distress tolerance. Check out those other books too, but it's hard to argue with the success of the Dialectical Behavioral Therapy Skills Workbook, and it only costs $15. If you're experiencing suicidal ideation, you need to work through it with a licensed mental health professional. This is a great book, but it is not an adequate substitute for that kind of professional treatment. Depression, anxiety, and PTSD all physically alter your brain. It is extremely important to understand these changes and how to properly treat them. The Body Keeps the Score by Bessel van der Kolk is the absolute best resource to learn how PTSD physically changes the brain and the nervous system. It explains the neuroscience of PTSD and is a deep dive into all the different treatment options. Learn how to get a free audiobook for The Body Keeps the Score by hitting the link here. Help us prevent suicide by sharing these videos. Also, like, subscribe, and comment to help the algorithm show this video to someone who needs it.